Well, hello and welcome to all of our viewers around the world. I'm Fiona Langsharp, IVCLC Director of Communications and MC here at Gold Learning. I'm so excited. We've got such a great package that we're going to be talking about today, and I'm delighted to have Kathy Parks back with me here at Gold Learning, and she's going to be speaking at our upcoming tongue tie symposium. So Kathy's going to be talking about, well, let's just say lots of things, but she's going to be focusing on those really challenging cases, complex cases of tongue-tied babies. What do we tackle first? Now, before we get into, what Kathy's going to be talking about, Kathy, welcome back. I just want to say hi to you. It's so good to have you here today.
I just feel I'm delighted to be able to speak for Gold. I feel like it's like the top notch online
Oh,
learning. So
well,
it
you're
gives me great joy.
well, if you haven't met Kathy before, Kathy is a longtime friend of Gold's and participant. I think even one of the great things when we come to, of course, Gold Learning and all of our live products, you have the opportunity as an audience member and a speaker to collaborate. I mean, and you're going to be doing that with us because you're going to be here live at the Tongue Tie Symposium, which is really exciting. And I know, Kathy, you and I have talked about how really, we are collaborators. The student is the one that teaches us the most and all those great things. So I know
Absolutely.
you're looking forward to seeing what folks have to say and ask about these cases as well, because it's one of the
Absolutely.
ways that you love to learn, right?
Absolutely, because I can think one thing, but I need that second set of eyes or that second brain or that fourth brain, or, I need that input so that
Mm-hmm.
I think we all learn to think outside the box that way. And that's kind of where this topic came from.
Right, right. And so, yeah, I mean, I don't know how you're going to cram this into an hour, but I know how you talk. I know how well you communicate. We were just talking. You're one of my favorite people when it comes to this style of communication because, for most of us, we want to take information, clinical skills, tools, evidence, and we want to put it into practice. And it really is challenging because, tongue ties, I mean, today can be quite intimidating. How do we make the right move? What do we do? All those types of things. And that's really part of what you're going to be speaking to, right?
It is. For years now, I've been studying um, tethered tissues. And it used to be that we just like sent them to the pediatric dentist or the ENT that were skilled in it. And now I think as IBCLCs who take on this extra challenge of helping parents with babies who don't have the best of oral functions, we are having to learn a lot more than just what is that frenum doing?
Mm-hmm.
And that's what the four cases that I get to present in this session are all tongue-tied babies, but there's a lot more going on with these babies. And to be able to see it and check with the parents. Is this what you're seeing? Is this what the baby's doing? To see it for myself, I've actually taken all the pictures and the recordings that are in this presentation. That's a first for me.
Wow.
So I get to present those to the world, and I think you'll be as surprised. Our participants will be as surprised as I was at what do we need to handle first here.
Mm, yeah. Well, I think, and this is what we've been crying out for, the controversy that continues to sort of surround talking about tethered oral tissue, TOTS, or, tongue tie as it's commonly known, it is the frustration, Kathy, that we have in terms of, it clipping or what lasering a tongue tie does not give the results that
Right.
initially we were all talking about.
Yeah.
And so our responsibility, like our role, has really become quite dynamic in a sense. But I feel like we are knowledge translators. We know the nuanced behavior of an infant, what they're supposed to be doing, how they're behaving. I mean, we gather all that information in a really good health history, then we translate it and give it back to the parents. But you're
Right.
right. we've done so much more now. We know because there's other modalities out there. They're doing so much collaboration with us. That's
Yes.
pretty exciting to, have all this knowledge in our community. We just
Yeah.
need to find a way to put it all together, right?
And to work together, because
Absolutely.
there's, like you said, Fiona, there's so much controversy on
Mm-hmm.
who gets to diagnose, because that's an
Right.
official medical term, unless you're a nurse. So we have nursing diagnoses. So
Yeah.
it's like, whose territory are we walking into? Whose toes are we walking on top of? How do we work together as a provider team, whether
Oh,
it's
yes.
ENT, dentist, lactation consultant, speech pathologist, occupational therapist, feeding therapist? I mean, all of those have a place at this table.
Mm-hmm.
But I think you're exactly right. We're the ones that kind of take the bits and pieces from all of those specialties and try and help the parents understand why just getting diagnosed on Facebook and going to the
Right.
dentist and having the release done did not fix their problem.
I know we have a lot of people self-serving, and there's nothing wrong with that. Like, we want parents to feel and know that they have
Absolutely.
the freedom to do what they feel is best. But we're really good at translation, when we have the experience. And I know that's what you're going to bring to the table here, which is just fantastic, because I think, curiosity is that, even when you have some experience under your belt, it's always good to do these, what I call these ride-alongs. So we're going to be, in your space. I know that you're going to be showcasing your clients specifically, which is great, and we're so grateful to all of your clients for, just providing the skills back to us so that we can learn together. One of the other things you and I just touched on, we were talking offline, and of course, you don't want to, you see Kathy and I chatting about this, like a lot of you out there, we've got, so much passion in this area. But talking about the research being really thin, because this is where, it's challenging for some people, to look at this. And the reality is that there just isn't a lot in
Right.
all different areas, in tongue tie release, the recovery process, and all these types of things. And folks are really worried about the, perhaps even the word aggressive, nature that has taken place in the
Right.
field.
Right.
There needs to be a coming together on the research. Kathy, would you agree?
Definitely agree, because there for a while, when we started doing the exercises, the stretches, we were
Yeah.
super aggressive.
Yeah.
And I've seen pictures of the scar tissue and the
Yeah.
horrible formation inside the mouth with
Yeah.
over aggression with
Right.
that. Well, we can't just let it be, or can we? We don't really know.
Mm-hmm.
And it's so difficult to do a double blind study.
Yeah.
Who are you going to? I mean, we can't do that on
Yeah.
babies. We cannot
Yeah.
do that on babies. And so, who's going to do the research? Who's going to provide the funding for the research? And where does that come into conflict of interest? And there's so many things to discuss just in the research of
Yeah.
this particular topic.
Yeah. It's going to be important that, um, really in the community, that when we come together, we look at what we can agree on,
Yes,
and build out from there. And I think something that we agree on is that, IBCLCs have really become, and they're the global expert, when it comes to looking at babies as a
right.
whole, as a global expert. And then we're now learning how we can work with folks in the community, resources that we can provide to families, because that's the foundation, in terms of what we're doing, and really help families make an informed decision.
Absolutely. And that's where we pull in the body workers, the craniosacral, the
Yes.
myofascial release, the chiropractic, all those things that are so beneficial to babies in the first place,
That's right.
much less if we've got a midline tension going on.
That's correct. Yeah,
So,
yeah. So
absolutely.
exciting. I mean, just
Yeah,
really. And I'm excited that you're speaking for our tongue tie symposium. We have such fabulous presenters this year,
you
all coming
do.
in from different modalities as well. So you're going to hear from all of them and how they approach things. And I know, Kathy, you're just going to do such a wonderful job for us. I'm excited to hear.
Thanks.
I've had a sneak peek at it already. And so I can tell you right now, you're really going to learn so much from what Kathy experienced from her clients. And then, she has all she's going to showcase all of those in picture form as well. So it's going to be fantastic.
Absolutely.
Thank you so much, Kathy, for
Thank
joining me here
you.
today. It's been
Thank you.
lovely having you. And to all of our wonderful friends out there, don't forget to head over to our website at goldlearning.com, where you can register today for the Tongue Tie Symposium. It's very popular. Let me just tell you that it's 2 days of learning, and it is jam-packed. You can actually choose 1 or 2 days. So you've got some options. It will be recorded, but of course, we will be live. So if you plan to come for those 2 days, it is one of those events. Get the crock pot on in the morning, get the kids occupied. But it is going to be
Yeah.
just, a really full educational tools that you will be able to take immediately into your community. So thank you again to Kathy for joining us. And we
Thank you,
will look
Fiona.
forward. Yeah, we'll look forward to seeing everybody online. Bye-bye for now,
Okay.
everyone.
Bye.